Thank you for staying with us. Before we get into the conversation on the 2020 African Vaccination Week, these tweets have come in. Adborinla says, not even in front of television, I have data over the years to back my assertions up. And to be honest, if we continue the way we are, the future is extremely grim rather. Whilst I know a good number of people trying to improve the agricultural space, we're running out of time. Igwe of Africa, Onyenkuzi, too, says, when I listen to the woman leader, it takes my mind back to my grandmom and what she passes through from planting to harvesting every planting season. Agriculture has gone tech. Nigeria needs to follow that path.
Indeed. We're still doing the kind of farming that our grandparents did with hoes and shovels. That ain't going to work to feed 200 million people. We need to go mechanized. Yes, 2020 African Vaccination Week, AVW. It's the 10th edition, not anniversary. It's the 10th edition of the African Vaccination Week, and this event aims to demonstrate the value of vaccines for the health of children, communities, and Africa. To tell us more about this, it's my pleasure to welcome the Executive Director and CEO of the NPHCDA, which stands for the National Primary Healthcare Development Agency, Dr. Faisal Shuaib. Good morning, Dr. Shuaib. He'll be joining us from our studio in Abuja.
Yeah, I don't think he's there ready yet. I don't think any of them is ready yet.
Oh.
Aleo, just before we go there, I think Abe the Patriot talks about trying out that website, the Obonge website. It didn't work. Okay, Abe, don't worry. Our technical crew would get in touch with you with some information on how to reach the Obonge people and the other websites that need to be reached. Aleo, before we get into the African Vaccination Week, you know, this matter of vaccination is a conversation that has gone on and on and on since the pandemic broke. It's this, it's for that, it's for this. And before that, I do know that one time we had the National Primary Healthcare Development Agency officials here talking about the issues they had convincing Nigerians to even take the vaccine.
Which one?
The polio. Yes, it was really a challenge.
It was big news. It was big news. It was big. We always refer to it because a lot of people still are very wary of allowing their children to take the polio vaccine. That's the way it is in Nigeria. Even though it's the 21st century, we still seem to be in the 18th century. We still see vaccinations. And did you see the video about the guy whose temperature was to be taken with a temperature gun, and he was?
That's not Nigeria. But it was funny, but also food for thought about how aware are the people? How aware are we generally? We're in Lagos, so someone might say, okay, we're aware. When someone points that at you, you say, okay, it's normal. But there are some communities that do not understand what you mean by that thing you're pointing at.
Very correct. It looks like a gun anyway.
Come on. Are you a hunter?
And you're pointing it at their heads.
Okay, so I think Dr. Faisal is ready now.
Okay, so Dr. Faisal Shuaib, Chief Executive Officer, National Primary Healthcare Development Agency. Good morning.
And Peter Hawkins.
Morning.
Thank you for joining us. We also have Mr. Peter Hawkins, UNICEF Country Representative. Good morning.
Good morning.
We also expect Dr. Richard Banda, Technical Focal Point, EPI, and EPI stands for Exocrine Pancreatic Insufficiency. But we have two guests already, and we'll just go on and have our discussion. Dr. Shuaib, how effective have vaccinations been in Nigeria?
Vaccinations, without a shadow of that, have been very effective in trying to reduce the incidence of vaccine-preventable diseases in the course of a child's life. We have demonstrated time and time again how vaccines are the most cost-effective way of preventing kids from actually coming down with diseases that could easily have killed them. And apart from those instances where vaccine-preventable diseases actually kill kids, there are also many instances where, because of the ill health, the child is not able to function normally. That interrupts the child's ability to have a good education and grow normally. So we are very proud of the work that the Federal Ministry of Health, the National Primary Healthcare Development Agency has done in the last few years in terms of making sure that the kids in Nigeria have the vaccines that they need to be protected against these vaccine-preventable diseases. I want to assure you that in the last few years that I've worked in this ministry and the agency, I have not seen staff that are so committed. It's outstanding. You know, like, these are really the heroes of the healthcare industry. If you're looking anywhere for Nigerians that are dedicated, that are committed, you need to just come to the National Primary Healthcare Development Agency, the Federal Ministry of Health, and you'll be amazed how people come even during the weekends to work. And we've seen how in the course of the last 2 years especially, a gradual but consistent increase in the number of children that we're reaching with life-saving vaccines. It's amazing.
We followed the challenges that you all went through when Nigeria was trying to kick polio out. And we saw how wary people were of allowing their children to take the polio vaccine. Are you saying that we have gone beyond that, that Nigerians will now readily accept to have their children vaccinated?
Oh, absolutely. We've really gone in leaps and bounds from the early 2000s, mid-2000s, when we had a massive rejection of polio vaccine under the assumption and negative perception that the polio vaccines will cause infertility. Because we collaborated with our traditional leaders, our religious leaders, political leaders, community-based organization, and media like you, we've been able to pass on the correct information about vaccines. And what we've seen since then is an improvement in the way people accept vaccines. We're not 100% there, because you always have a few individuals who have suspicions that cannot be validated, that cannot be justified. But for the most part, we see that Nigerians are getting the information that they need around how they can access the routine immunization vaccines. And we see that with the increase in the numbers of children being vaccinated, that tells you that women are bringing their kids to the health facilities and getting these vaccines. And we now have just the problem of making sure that those primary healthcare centers that are supposed to deliver these vaccines have the right infrastructure, the right human resources, the right electricity and water. And this is what we're doing with the state governors to make sure that in each and every ward in Nigeria, that you have at least one functional primary healthcare center that can provide a wide range of services: immunization, antenatal care, nutrition, treat malaria. So an integrated service being provided at these primary healthcare centers is what will also concomitantly make sure that the immunization rates actually reach the levels that we want to reach. We're really proud of the work that our frontline health workers are doing, and we feel that at every opportunity, such as the African Vaccination Week, we have to say thank you very much for being our heroes, and also continue to strengthen our partnerships and advocate to governors, to chairmen of local government areas around the need to make sure that immunization services, primary healthcare services as a whole, are well resourced. Because when you have a healthy populace, then that has a direct sort of impact on the socioeconomic status of any country. When you look globally, where you have seen that immunization has increased, primary healthcare the health sector improvement, you see how really the lifestyle, the improvement in the socioeconomic investments have really followed and paralleled the development of these societies. So we see that this is where Nigeria will be going to in the next few years.
Okay, Dr. Schreib, I'll come back to you, but let me take this to Mr. Hawkins. What's your role? I mean, what's the UNICEF's role in this process of vaccination?
Thank you very much, and it is very important in this week of African vaccination celebration to reinforce the partnership that we have with the government of Nigeria in bringing in vaccine in the chain of supplies of both vaccine and equipment, but also here. And I was struck by your comment about the polio vaccine. I happened to be here in 2004 when that was ongoing, and the leaps and bounds in which we have adapted not only to people's concerns, but also the way we deliver the vaccine. So 16 years later, we're now at the verge of Nigeria becoming polio-free certified. And that is a big step in 16 years. And it's about trying to engage with the communities, have them understand exactly what is happening. The voluntary community mobilizers are better informed, better receptive to ideas from the communities. And as Dr. Faisal said, the sort of heroes of the front line of healthcare in this country, the vaccinators and the primary healthcare workers are there to actually serve the people, and the people are demanding the service. So vaccine, which 20 years ago was a problem, is now becoming more of a norm. The challenge going forward, and this is where the partnership is so important, is making sure, especially at this time, that the investment is real, the human resources are improved and built up, but the engagement with the communities continues so that routine immunization becomes the norm in Nigeria, and every mother, every father take their newborn child to the primary healthcare center, go through the vaccination process over the first year especially, so that the child is vaccinated against preventable diseases and has the best chance in life.
Mr. Hawkins, is any UN agency collaborating with government at this particular time to curb the spread of COVID-19?
We all are, and we're here as one UN, and all the organizations are working together with the Presidential Task Force and the NCDC, and working with MPCDHA, NACA, and others to bring in the capacity to ensure that the pandemic doesn't overtake what is happening. And I want to say at this point to the Presidential Task Force and the NCDC are doing a brilliant job. And the challenge we have now is at state level is replicating that to try and ensure that the pandemic is contained, that testing, treatment, and care and isolated care takes place, but also at the same time is ensuring things like the vaccination of preventable diseases, routine immunization, continues not only in itself, but is also improved so that the effect of COVID-19 on campaigns and so on is not felt, so that we can save as many children, not only with COVID-19, but also through vaccination of preventable diseases. That's also the case with nutrition and antenatal, is really reinforcing the system so that we can, the child and the mother has the best chance to be able to get through this pandemic.
Dr. Shanaib, this vaccination week is coming indeed within a period when a lot of people are avoiding the hospitals as best as they can for different reasons. Also, there is the other thing about people talking about all manner of theories coming up about the effects of vaccines at this point in time, and all manner of things going on out there. So we would look at the clarity or clarifying on some of these areas and how the routine vaccinations can carry on even in the midst of this pandemic. But we'll do that when we come back from this break. Thank you for staying with us. We're looking at the 2020 African Vaccination Week, which happens to be coming within the period of the pandemic and a lot of people avoiding the hospitals for one reason or the other. It's
for
bound
obvious reasons.
for obvious reasons. But it's bound to affect the routine immunization. So, Dr. Faisal Schweib, who's the Executive Director, CEO of the Nigeria Primary Healthcare Development Agency, tell us, how is the routine immunization working out? I mean, you have talked about your workers who should be commended, and I put my hands together for them. But even at that, how are they carrying on routine immunization in the face of this and social distancing also?
Right. So this is why I say the frontline workers are doing an outstanding job, because even in the face of this pandemic, we've done supervisory visits to some of the health facilities, and we find that our primary health care workers are still in their health facilities. Even during the lockdown, we did some sampling of some of the primary healthcare centers, and we found that the services are there. However, what we've witnessed is that because people are, concerned that they might come in contact with COVID-19 cases, and then secondly, because of the difficulty with getting transportation during the period of the lockdown, a lot of parents did not avail themselves of the opportunity to vaccinate their kids. So we've seen sort of a lull in terms of the numbers of parents taking their kids for these services. So this is what sort of spurred us to come out with a public service announcement in the last couple of weeks to re-emphasize the fact that these services, even beyond immunization, continue to be provided in the primary healthcare centers, and that parents and guardians should avail themselves of this opportunity. We have also gone back to our community leaders, the gatekeepers, to say, immunization, primary healthcare is owned by the community members. So the traditional leaders, just like they've done in the last few years, need to, at this moment, continue to encourage community members to take their kids to the primary healthcare centers. I'm sure that you've also heard from our traditional leaders, the Sultan of Sokoto leading the traditional leaders has come out on several occasions to talk about the need for the primary healthcare services and actually secondary and tertiary healthcare services as well to be maintained. So while we have seen a dip in terms of people accessing routine immunization services, we are working with our community members, we're working with civil organizations and saying that, we really have to, and the health workers are there, we're providing them with personal protective equipment, at least the face mask, the hand gloves, the sanitizers, to make sure that they feel protected, right? We've told all our health workers that you must feel very comfortable. You must feel secure in the work that you're doing. Otherwise, we will not put you in harm's way. We've also gone ahead to build their capacity. We came out with a comprehensive manual right early in the days of the outbreak in Nigeria that will guide primary healthcare workers around how they need to structure their health facilities in a way that people who may have suspected symptoms of COVID-19 do not come in contact with those who have different symptoms. And we're saying that they are also stepping up in terms of infection prevention and control, making sure that even before their service sessions, they clean up the place, they disinfect the place, and then even afterwards, they make sure that their health facilities are disinfected. So we're providing the kind of support that is required at the primary healthcare centers. We've done trainings. Even as I speak, we continue to do step-down trainings to the states and the local government areas. Some of the states are concluding their trainings this weekend, while others will flow over to next week. But we're going beyond even the primary healthcare centers and making sure that at the community level, that the volunteer community workers, the village health workers, the traditional birth attendants, the town announcers are going from community to community, again, under the leadership of our traditional institution, to make sure that the correct information about COVID-19 is being passed, that they also make sure that there's a clear understanding of the epidemiology of the disease so that stigmatization, discrimination will be reduced to the barest minimum. When people have a clear understanding of a disease, then this misinformation does not spread like wildfire. So we're working really in close collaboration with our colleagues from the Federal Ministry of Health, from the NCDC, from the National Health Insurance Scheme. We're working with even the NIPRID, NACA, with everybody that is involved in this space, all of us under the leadership of the Presidential Task Force on COVID-19, to say not only are we trying to stem the spread of this disease, but also to make sure that routine services continue in our primary healthcare centers so that at the end of the day, we do not lose more people from other diseases rather than while we are focusing so much on COVID-19. And so far, you know...
Dr. Shaibu, I might have to, let me just interrupt you here and put this question in. There is still this rumor going around about the use of vaccines for COVID-19. I know you're talking about going through the traditional institutions, but that's not appearing to stem the spread of the rumors about vaccines and COVID-19. What is your agency doing anything to clarify that?
We're doing in terms of making sure that the right communication, the right information goes to the communities, right? So apart from the interpersonal communication that we're doing, we also have produced in conjunction with the NCDC information, education, and communication materials, right? Working with our development partners, this is why we have the UNICEF here, we have the World Health Organization. We're working together as a team to make sure that the correct information goes to our community members. It's kind of hard in the day of in these days of social media to prevent fake news. But one thing that gives us confidence is that once community members have the right information, then even when they read all of this information about people wanting to be forced to take vaccines, you know, they'll look at it and say, oh, this is fake news, right? In the first place, there is no vaccine that is available for COVID-19. What the pharmaceutical industry, what people who work in the vaccine space have made it very clear is that we are at least a year to 18 months away from any vaccines. So when people are spreading fake news that all Nigerians are going to be forcibly vaccinated or there are experimental vaccines that will be used in Nigeria in the next few days or in the next few weeks, you know, it's a no-brainer that it makes no sense that if there's no vaccine, how can you be talking about experimental trials? So I also want to make it very clear that Mr. President, you know, has been one of the foremost, advocates of immunization in Nigeria. He has immunized his grandchildren, and you know the support that he gives to the immunization program, to the primary healthcare program, is unprecedented. The support is for our routine immunization program. We want to sustain our routine immunization program so that people do not die from vaccine-preventable diseases. The issues of vaccine against COVID-19 are issues that we will deal with later. But we have organizations such as NAFDAC, which has been charged with the responsibility of examining every drug, every food, any vaccine that will be introduced to Nigeria. NAFDAC is led by Nigerians working with our development partners. We have the integrity to make sure that we will not bring anything that will harm Nigerians. This is public service, right? This is exactly why we're here, to do what is sacred in the interest of Nigerians, to protect Nigerians. So it's fake news when people talk about these vaccines being available to harm Nigeria. Never in a million years will anybody who is a Nigerian, you know, sign off to that, right? So we see example of the polio, the anti-polio elements that said, oh, the oral polio vaccine was going to stop Nigerians from, having babies. It's an infertility producing agent. But look at how Nigeria's population is growing, right? Look at how in northern Nigeria, the average woman has, what, 5, 6, 7
Interrupt
kids.
you.
Right?
I have
So,
to interrupt because I need to get this question in before we go, and we're winding down right now. How can Nigerians and other parties support NPHCDA's mission to increase uptake of routine immunization?
So the uptake of routine immunization is everybody's job in Nigeria. Every single Nigerian has a responsibility to support NPHCDA to pass on the correct information about the value of immunization, about how effective immunization is, and how in the last few years we've been able to demonstrate that some 2 to 3 million deaths are averted as a result of immunization alone. Even it's one of the outreaches that we use in the routine immunization program, the pneumococcal vaccine, for example, has prevented up to 40,000 deaths annually, right? So it's a no-brainer that everybody needs to come on board to support immunization. It's very clear that immunization works, and we should encourage at every opportunity parents to take their kids. We should encourage governors to make the necessary budgetary provision to make sure that apart from fixed posts where vaccines are given, also the outreaches, the transportation, the logistics that is necessary to get to the hard-to-reach areas, right? So at every opportunity, it is everybody's work. It's not just NPHCDA, but everybody's job to speak positively about how we've been able to eradicate smallpox using vaccination, how we are this close. Next month, we'll have been declared polio-free, again because of vaccinations. So it's such a task that everybody has to be involved in, and we're proud of the leadership that is provided by President Muhammadu Buhari, the Honorable Minister of Health. We're proud of all the partnerships that we share with the UN agencies, and we're very confident that we're able to reach our marks. We're going to get past COVID-19, and we'll continue that trajectory towards making sure that every kid in Nigeria gets the vaccines that they need.
Okay. Mr. Hawkins, real quick, in like 60 seconds, do you see any challenges ahead, and how can they be resolved?
The main challenge is protection of health workers, is making sure there are sufficient PPEs in country as quickly as possible for every single health worker to be able to be protected. Because once you protect them, they can protect the population. The second is greater consistency state to state on and in around immunization. And then the third is ensuring that the communities have a system whereby they can feed back any of their concerns so that the primary healthcare process, especially around routine immunization, but also nutrition, antenatal care, can get engaged with the communities and meet their needs and their concerns rather than impose their needs upon them. Those three, if those are done, we will be in a very good position over the next 2 to 3 years to be able to really improve the routine immunization and the protection of children here in Nigeria.
Mr. Peter Hawkins, UNICEF country representative, thank you very much for coming on the program this morning. And I'd also like to thank Dr. Faisal Shuaib, who is the Chief Executive Officer, National Primary Healthcare Development Agency. Thank you both very much for coming to talk to us about the African Vaccination Week. Sunrise will be right back in a short while with another interesting conversation. Stay with us.